How about now? Good? Cool. All right. So welcome to the trauma presentation that I'll be doing today. My name's Juan Olivera, and I'm one of the mental health counselors here at Trinity River. So today we'll talk about the different types of trauma, kind of define that a bit, and also talk about how it affects us and some different types of treatment for trauma that you may or may not know about. At any point, if you have a question, you don't have to raise your hand. You can just ask it out loud. I don't mind that at all. I want this to be interactive. If I'm not speaking loud enough, you can call me out, and I will try to speak a little bit louder. My voice is usually kind of soft, so speaking louder is something I have to try to do. Any questions before we get started? Cool. Okay, so there's a few different definitions of trauma. In today's world, we see trauma defined in informal ways through social media, Instagram, TikToks, and things of that nature. We hear about it from friends, family members, and acquaintances. Sometimes we hear about it in class, depending on what the subject is. But here we'll define it in a few different ways. Trauma is an emotional response to a terrible event, like an accident, rape, or natural disaster. Different definition. This one's geared more towards children and adolescents. When a child feels intensely threatened by an event he or she or they are involved in or witness, we would call that event a trauma. And that's from the National Child Traumatic Stress Network, which is a very big organization that provides resources and information on childhood trauma. Different definition from the Substance Abuse and Mental Health. I forgot what the other S stands for. Describes individual trauma as an event or circumstance resulting in physical harm, emotional harm, and or life-threatening harm. The event or circumstance has lasting adverse effects on the individual's mental health, physical health, emotional health, social well-being, and or spiritual well-being. So it affects basically every single part of us. It affects the whole person, not just one part. Well, trauma can happen to anyone, any age. It doesn't matter where you grew up. It doesn't matter what your status is or anything like that. It doesn't matter what your educational level is. It can happen to literally anybody. Some other people, certain groups of people are more susceptible to trauma depending on different things such as race or gender, sexual orientation, personality, stress tolerance, genetics. So I don't know if any of you have ever heard the term generational trauma. But that is something that can be passed down depending on how the previous generation of family dealt with that or did not deal with that. For example, people who have gone through different types of events such as slavery. That's definitely a very impactful generational traumatic event. Other things such as genocide or war, like survivors of the Holocaust, that is also a generational traumatic event. Or maybe just something more like a family who has gone through abuse several times in different ways, and they just didn't deal with it in a healthy way. So those caregivers pass on those things to their children and so forth until someone breaks that cycle, which is a a thing that requires a lot of strength and courage to do, but it is definitely possible. So I'm going to talk about two different types of trauma: big T's, T meaning trauma, and small t's. So first I'll define a big T. Big T is the thing that you think about whenever you hear the word trauma most commonly. So like this workshop is titled More Than War and Abuse. Well, war and abuse are some of the main things that we think about when we hear the word trauma. A large T trauma is a distinguished as an extraordinary and significant event that leaves the individual feeling powerless and possessing little control in their environment. Some examples of this would include war, physical, emotional, or sexual abuse or assault, being a victim of a serious crime, being in a disaster such as a tornado, a tsunami, a fire, a serious accident like a car accident of some sort, being involved in an active shooting environment, witnessing someone take their life, or witnessing someone severely hurt themselves, witnessing someone do something damaging to someone else, or even, especially like in children and adolescents, hearing about these things happening to a loved one can also be traumatic. Grief can be traumatic as well. When you lose someone extremely close to you and that person is no longer with you, that can definitely be very traumatic as well. A small T is a trauma that is more, it's less of a one-time event. So being in a major car accident, okay, that happened one time, but it has a very major effect and it lasts for quite a while. It affects you in how you are when you operate a car. It affects how you feel when you're driving or when you're a passenger. You might get flashbacks while you're driving and remember the event. It might make you shake. You might have to pull over if you have a panic attack, things of that nature. So that's like a one-time trauma, but it is very major. A small T is something that can happen for an extended period of time over and over again for months or years. That can include something like emotional abuse, being berated, being told things like you're not worth anything. It can be a parent, it can be a sibling doing it, it can be a romantic partner, a friend, being betrayed, things of that nature. So while it's not necessarily life-threatening or threatening to like your body, it is still something that can impact us over time. And the effect of a small T can be worsened if you experience a big T. Like for example, someone who was emotionally abused for several years and then they get assaulted in some form. It can definitely activate and worsen the effects that they were already having. It can increase their depression or anxiety or fear that they have. So that's something to keep in mind as well. Other examples of small T's are interpersonal conflicts. So let's say that you had a very close friend to you or a cousin or a sibling, and then they do something to betray your trust, and you never imagined that they would do something like that. Well, now because of that, you have a fear of trusting new people and letting new people in. And you might put like a guard up or a wall up to try to prevent yourself from becoming hurt again the way that you were. So that's one example. Same goes with infidelity. You thought you trusted someone, you thought they were your partner, and that they would never do anything like that to you, but then they do that, and it affects your trust and your ability to form a new romantic relationship or a healthy romantic relationship. Divorce, this affects everybody involved, not just the people getting divorced, but their family members, children, etc. Abrupt or extended relocation, so that means like being forced to move out. Abrupt means all of a sudden. Extended meaning happening for a long period of time. Legal trouble can also be traumatic in several different ways. The thing that comes to my mind is like navigating like the immigration system, navigating when a caregiver is incarcerated, especially if it's for an extended period of time, or a partner, or just someone who's significant to you. Obviously, financial worries or difficulty, and then psychological or emotional abuse, which is, in my mind, one of the most lasting and impactful types of small traumas to experience. Sometimes the effects of trauma can begin right after. So let's say you do get in a really bad accident. Well, you start having like nightmares about it. Sometimes you might be sitting in class and you start thinking about it and you feel like it's happening all over again, even though you're not there currently. Sometimes the effects only last a little bit so maybe like a month. You think about those things for a month or less, a few weeks, and then it kind of resolves itself and you don't think about it as much and it doesn't affect you as much. Sometimes it can take time for those effects to set in because of the way that our brains process things. It might not happen right away. So sometimes it can be a month to 6 months before that sets in, which is actually a diagnostic sub-criteria called, I believe it's along the lines of delayed post-traumatic stress disorder. So that's something to be considerate of as well. So we kind of already know these things, at least partially because of what we've heard or what we've learned in class or what we saw on TikTok. So this is different mental and emotional impacts of trauma. It's not a comprehensive list. This is just a partial list. So I'll define the words that you may or may not know. So hypervigilance is always being on edge, always looking around for danger, not feeling like you're not able to relax, just feeling like something bad is going to happen and expecting the worst, feeling sometimes even paranoid. It can go to that extreme as well. Apprehension, so that's kind of like, okay, well, I don't know if I want to do this. I don't know if I want to go to this place because X, Y, and Z might happen. So that's just kind of like being hesitant to do something because of a fear. And then flashbacks are when you think about the trauma and you feel like it's happening over and over. So the memory replays in your head. It can happen at random times, or it can happen because of something that might have triggered it or reminded you of it. Any questions so far? Dissociation, I made a separate slide for this because this is one of the key symptoms of post-traumatic stress disorder. So dissociation causes different things such as confusion, memory disruption, meaning like you might be doing something and like you don't really remember what was happening during that event or that time. A friend might tell you, hey, remember when so-and-so made a joke and everybody laughed? And even though you were there, you were kind of checked out or spaced out, so you don't remember what that was. And I'm not talking about like regular daydreaming. This is specific to a traumatic event. Feeling frozen or stuck, just kind of like feeling like you're not able to really move or do something or stop what's happening in your head. Not feeling present, just being unaware of your surroundings and trouble concentrating. So dissociation can definitely make learning a lot more difficult. It can make being sociable more difficult, and other things as well. I'm going to take a drink because my throat's a little dry. Okay, behavioral impacts of trauma. One of the top ones is avoidance. So avoidance means trying not to be associated with a memory or a trigger or a situation that might remind you of a trauma. This can be a physical avoidance, so trying to stay away from certain places, driving in different areas. Maybe like you don't want to pass through a neighborhood that reminds you of something bad that happens. You might avoid people, so that's a very common thing as well, especially if they're the ones that did something to you that was traumatic. It can be emotional avoidance, so this is like trying not to think about something because it's causing you stress, or it's causing you depression or anxiety, or it's or it's preventing you from getting good sleep, or takes away your appetite, any of those things. It can be behavioral. Some examples of that are isolation, so kind of like staying by yourself, not being around other people, withdrawing. Substance use or self-medicating, using alcohol, drugs, or other substances to cope with the negative emotions and thoughts associated with trauma. It can go to the extreme of self-harm, such as cutting, burning, or eating disorder behaviors. Suicide attempts, impulsivity, so engaging in reckless behavior, risky behavior, kind of like to take yourself away from that, from being present, from having those thoughts and feelings. So it's kind of a form of avoidance in itself. And codependence, heavily relying on someone else to help you regulate your own emotions. But when that person isn't there, or that person isn't doing what you think they're supposed to do, it affects you much more negatively. So that's something to keep in mind as well. Physical impact, sleep disruption. So someone with trauma often has a really hard time falling asleep, or they might sleep way too much. They might have nightmares. So nightmares, they can be related to the traumatic events, or they can be nightmares completely unrelated to it. Changes in hormones, so it actually does affect us on a physiological level, especially if your body is still developing. So if you're a child, a teenager, even an infant, or an early adult. Essentially before the age of 21/25, depending on your own personal body and gender. So that's something to consider as well. It can make your heart race. It can affect your breathing. It can affect how tense your muscles feel. Sometimes people, when they think about trauma, they start sweating or doing something. Maybe there's an associated sensation related to the trauma that comes up during this as well. So these last two things on here, I'll briefly define. The sympathetic nervous system is something that prepares us for some sort of danger or to face something challenging. So it's in charge of essentially preparing us for something stressful, like if we have to get into a fight. Our eyes might dilate to help us focus more. Our blood will start pumping faster. Our breathing will be affected. Our heart will also increase in rate, and a lot of different things. So the sympathetic nervous system is something that it's that we all have, and it's normal for it to get activated when we're in dangerous situations. However, someone who experiences trauma, their sympathetic nervous system gets activated when there's no real danger present. So the body thinks it's in danger because of the trauma and how it's affecting our emotional and mental health, but really there's no present danger currently. So that's something that when it's activated for a long period of time, it can actually start affecting our health because we're not supposed to be activated all the time or the majority of the time. And that's connected to what I talked about earlier with hypervigilance, always being on edge, looking for danger, things of that nature. The parasympathetic nervous system is kind of like the opposite of the sympathetic nervous system. So it helps our muscles to relax, it helps our blood flow to reduce, our heart rate to reduce, it helps us feel calm or peaceful. So it essentially regulates our body to go back to neutral, if that makes sense. So I'll talk about the brain only a little bit, very tiny bit. So 3 main parts of the brain get affected when someone goes through a trauma. So the prefrontal cortex, that is what helps us to think and concentrate, to rationalize, to be able to learn in class, things of that nature. So it helps us to regulate our emotions and our fear responses from a different part of our brain called the amygdala. That's in charge of our emotions. That's in charge of our fight or flight response, which is essentially what we feel when we're in danger. So the amygdala is wired for survival. Even animals have this. So it's common for animals to have a higher amygdala because they're in constant danger. They're, the food chain and everything. It's normal for that to happen. But us as humans, we're much different from an animal. We're not supposed to be in survival mode all the time because that can affect us in different ways. So the amygdala actually grows in size when someone has been impacted by trauma. And then the hippocampus is responsible for memory. So this shrinks when someone has experienced a trauma. So it's more difficult for our thinking part of our brain, which is our prefrontal cortex, the hippocampus, which is in charge of making memory. So both of those areas are reduced, and then our emotional response, the amygdala, is increased. So that's what kind of keeps people in fight or flight or supercharged sympathetic nervous system. On the right is a MRI of an example of someone with a healthy hippocampus, so someone who has not experienced a severe trauma event. And on the right is shrunken hippocampus. So that's someone who has not yet gotten treatment for a severe traumatic event. Keyword, has not yet gotten treatment. So it is possible to reverse these things if you get, the proper treatment for your specific trauma. And that's individual to all of us. Any questions? Yes.
Did you say once you get treatment that your hippocampus, and I can't say the other way, that it can go back to what it's supposed to look like?
Yes.
Okay.
Yes, that is accurate, yes. Yeah, so in getting treatment, it can grow back to the size that it's supposed to be, or at least increase in size. So even if the treatment that you get doesn't help you 100%, depending on, what type of treatment you got, if you did everything that you were, recommended to do, if you went to all the therapy sessions or whatnot, and adhered to medication, things like that, which I'll talk about in a little bit, 50% increase is much better than 0. 10 or 20% increase is much better than 0. So even if it only grows back a little bit, that is way better than not at all. So trauma can affect different things over time. So our relationships, not just speaking of romantic ones, but also just like our colleagues, our coworkers, our family, and things of that nature. Our social interactions, just like who we talk to on a daily basis. or who we pass by, strangers at a grocery store, things of that nature. It can affect our motivation. It can affect our self-care, so how we take care of ourselves. It can even affect things like activities of daily living, which are like taking a shower, brushing our teeth, eating when we're supposed to, and things of that nature. It can impact us to where we start neglecting major responsibilities. Maybe it impacts you so much that you don't even want to go to work anymore and you don't want to go to class anymore. Or maybe like a caregiver who's impacted by trauma, fails to do what they're supposed to do to their family, and things of that nature. And then one of the most important ones, I mean, they're all very important, but